Hello, my name is Peter. Uh, I'm here with my patient. Um, she's going to state her age. She's going to give consent to recording and also to post the video through an online medium. May I know your age, please?
38.
38, okay. Do you agree to this recording?
Yes.
And are you okay with the video being posted through an online medium?
Yes.
Okay. So she has agreed that and he has consented, and I'm going to start my assessment. The first thing I'm going to do is that I'm going to check the skin. I can see the skin is normal, is appropriate for the complexion and the ethnicity, and also I don't see any kind of perspiration or any kind of changes. Uh, there's no tinting on the skin, and there's no bruises, and everything is within the normal limits. Um, Also, when I check the next thing, which is like the head, I can see the head is normocephalic. The hair distribution is within the normal limits, and I don't see any kind of change from the normal structure of the head. When I check the face, I see the face is appropriate for the ethnicity, and I see there's no bruises, there's no any kind of changes on the face of the skin. So if I touch the face, I'll be checking like the facial nerve, number 7, and everything is within the normal limits. And or the next thing I'm going to do, I'm going to check her eyes. The eyes, I'm looking at the accommodation. I'm checking also at the movement, the eye movement. I'll be checking the cranial nerve number 3, 4, and number 6. And so I'm going to use a pen light to check the light accommodation. So I can see everything is within the normal limits. The pupil is accommodated to the light, and also I'm going to check the conjunctiva. I see the conjunctiva, there's no redness or swelling, everything within the normal limits. I check the sclera. Sclera is within the appropriate color. There's no redness, and there's no any kind of drainage which is coming out of the eye. The next thing I'm going to check also is the nose. Uh, I'm going to use my light to check the nostrils. I see the septum is within the normal limits, and there's no any kind of a change. There's no deviation of the septum. There's no drainage which is coming out of the nose. The next thing I'm going to check is the mouth. So at the mouth, I'm going to be checking cranial number 9, number 10, and number 12. So she's going to open her mouth. So I'm going to use like something like a tongue depressor just to check the mouth. I'll be checking that at the uvula. I'm checking also at the inside the mouth, just making sure that everything is normal. I see the uvula, there's no swelling, the tonsils are not swollen, and everything looks within the normal limits. So the next thing I'm going to do is that I'm going to check her eye movement. So she's going to follow my direction. Uh, so the eye is within eye movement is within the normal limits. There's no kind of any kind of disorder or something going on with with a visual sight, which can indicate something with the eyes. So the next thing I'm going to check also is her ears. I can see there's a normal the normal shape of the ears. I don't see any kind of a drainage in the ear. And when I touch the ear, I see there's not kind of a tenderness or kind of any kind of a swelling. So the next thing I'm going to do also, I'm going to check the tonsils. I'm going to also check. I'm going. I'm sorry. I'm going to check the lymph nodes. So there's no swelling of the lymph nodes. There's no any kind of sign or of infection. So the needles can move around, and also I can see that there's no any kind of a swelling. The next thing I'm going to check is her shoulders. So the shoulders are within the normal limits, and there's no kind of uh, any kind of a swelling, and there's no any kind of any abnormal movements. And if I touch, there's no any kind of a tenderness, and the trachea is there's no deviation of a trachea, and everything is within the normal limits. So the next thing I'm going to check, I'm going to listen to her her cardiac, and I'm going to start with aortic on this side, and then I'm going to listen to pulmonic. I'm going to listen to the Erb's point. I'm going to listen to tricuspid. I'm going to listen to mitral, and I see everything is within the normal limits. The next thing I'm going to do is to check the lungs. I'm going to oxidate the lungs. So I'll start at the front. So we have the four lobes at the front. So I'll start on the right, and then the left, and then I'm going to move to the lower right. I'm going to check the lower left. I don't feel any kind of wheezing or any kind of something which is out of norm. The breath sounds are within the normal limits, and the chest position and structure is within the normal limits. Everything is structured and symmetrical. So I'm going to listen at the back. So I'm going to ask my patient to stand up and turn around. So I'm going to check at the back of listen to the lungs. I'm going to start here, and then I move to the right. Right. Okay. Go ahead. Okay. 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 Breathe in. Okay. Breathe in. Okay. Okay. You can breathe in. Okay. So the lungs are functional, and everything is within the normal limits. I'm going to tell her to sit down. The next thing I'm going to do is that she's going to lie on her back, and I'm going to listen to her bowels, abdomens, and also the bowel sounds. So we are going to divide the stomach into 4 quadrants. So these are the 4 quadrants, imaginary 4 quadrants. I will listen to the top right, top left. So the bowel cells are within normal limits. They are not hyperactive, and I don't also see anything which indicates that there's something going on with the abdomen. So everything is within the normal limits. Okay. So the next thing I'm going to do is just to make her like hold my hands. I'm checking the strength of her hands, and also I'm going to tell her to squeeze my hands. So I'm also the range of motion. I'm going to tell her to lift up her hands and also to touch her nose. Okay. And then I'm going to tell her to stand up, and she's going to kind of just try to touch her feet and try to touch her knees, and just check and make sure that there's nothing going on. Okay, you can sit down now. And then I'm going to check her reflexes. I'm going to lift up her feet. So so I don't see anything going on with her feet, and the reflexes and the sensations are there. So everything is within the normal limits. So I think I'm done for now, and thank you.